as we observe Lucian's gait, you can see that he kind of has short, choppy movements when he walks, as well as he's not at a 90-degree angle from his front paws to the back when he walks. He walks a little stiff. This is why we think he's a good candidate for cranial sacral therapy. Okay, we are going to start Lucian's cranial sacral therapy. Also, as you observe as he sits, you can see that his wrists kind of point outward. So carpal largus and targus are inside or outside, or east or west hocking. So there is some asymmetry right there, as well as his face isn't in a complete parallel line. It kind of swerves to the right a little bit. So we are going to start our cranial sacral therapy, and we will start with the atlas. I only have to use 2 fingers because he is very small. Hang on. And then we'll move down a little bit more to the cervical vertebrae from C2 to C7. Hang on, Luke. It's like fingers and thumbs will be over the TPS and the SPS. Hang on. And then we just wait for a release. Seems to have some pretty good flow there. So I'll move down a little bit more. Now I'll move down again. I don't feel any tension or disturbances in his flow there. Then we're going to go to the shoulders and wait for a release there. There is some tension, so I'm going to have to stay a little bit over there. Hang on. And there's his release. So then we're going to do the thoracic. I'll have one hand under and one hand above. There's no abnormalities there, so I will move down to the lumbar, which would be the lower back. Just apply slight pressure and wait for palpitations, feel any tension, and then just wait for him to show a sign of release. He seems to be struggling a little bit, so I'll stay a little longer right here. And there's his release. Then I'll go down to the sacrum, which is just above. Hang on, Lee. You don't like this one so much. Just above his tail and below. It's a little bit of tension in there. Wait, wait. And we're going to do leg unwinding. Since he does have choppy movement in the front of his feet, I think I'll stay on his legs a little bit because there might be more tension in there. Lucian. And there is some tension in there. I'll have to stay a little bit longer. Hang on, Lucian. You're okay. I know, I know. And we just wait for him to release. And there's his release. And then I'll do his back leg on the same side. No, I know, I'm sorry. And we're just doing a little leg unwinding. Just gonna wait for him to release. Hang on, hang on. Hey. And then we got to do it on the other side. Hang on. Hang on. His front paws do seem to have more tension in them. So I will stay here a little longer on the leg unwinding. And there's his release. Hang on, Luke. I gotta do your back leg still. Hang on. Hey, Lucian. Hey. Lucian. Okay. Lucian. You're fine. You are fine. Chill out. Lou. Hang on. He is making it a little difficult. You're okay. Hang on. Wait. There's his release. Wait. And we're going to do the tail unwinding, where I'm going to have one finger under his tail, one finger above, and just apply gentle pressure. I'm sorry. There's his release. And we're going to do, for going deeper, hang on. We're going to do the back release, which is here and here. Wait, oh shit. Since he had so much issues with his back legs unwinding. Hang on. Hang on. You probably benefit from the back release since he has so much tension in the back and the hips. So I would recommend the back release. Hang on. No longer, you gotta release. And there's his release. And then finally, we're going to do the cranial realignment. So I will start up here. Hang on, Lou. And I will visualize putting his bones back where they're supposed to be, where they're supposed to be aligned. And I will start with the parietal sutures. And then move my way to his frontal bone. Hang on, Lucian, hang on. Just slowly picturing the bones going back to the way they were, having the flow just flow without any interruptions. Then we'll do the lacrimal, which is just right under the eye. Hang on, hang on, hang on. I'm going to try and do both sides since he's so little. Hang on, Lou. It's enough. Hang on. We wait for his release. And we'll do the nasal. Hang on. And just slowly picture everything going back to the way it's supposed to. And finally, we will do the maxilla sutures, which will be in this area, kind of like the jawbone. Let me just picture it going back to the way it was, even flow, no blockages. We just wait for his release, which could be a sigh or a lick, or it could just be the body relaxes, which he hasn't quite done yet. It's still pretty tense. And there's his release, and that is Lucian's cranial sacral therapy.